A recent outbreak of measles here in the U.S. exposed the reality that many families are still choosing not to vaccinate their children. Those rates, however, appear to be on the rise here. Dr. Lyn Rynta of Children's Hospital of Wisconsin is here now to talk to us about the impact of all of this. Good to see you, Doctor.
Hi, nice to see you as well.
All right, so let's talk about vaccinations. I think people, every time we start talking about having a measles outbreak or something we haven't seen for a while, I think people are surprised to learn not how few, but I believe probably think we're more widely protected than we are.
Right. I think that there's certainly a lot of room still for improvement. In general, 5 years ago, in our community, when we thought about vaccines for kids 2 and under, only about 50% of young children were completely vaccinated and up to date.
Well, let's talk about how you're doing within the Children's Hospital system. I know numbers are up for you. I'm looking at one here, Children's Hospital of Wisconsin up from 53% to now 73% for a certain category of children. Right.
So 5 years ago, we decided we really wanted to do something to really make an impact on the health in our community. So for the last 5 years, we've really worked at trying to improve vaccine rates and improve awareness around the importance of vaccines. And we're happy to say that in the population of children 2 and under, we've been able to see a rise from 53 to 73% in 5 years.
And up everywhere else pretty much around the state. Milwaukee County's up, southeast Wisconsin as a whole, northeast Wisconsin, and the state is up by 6 or 8 points.
Right, because it's all about collaboration and working with other people in the community. We want to make sure that we are using all our efforts wisely and working. So we've worked well with the state as well as the local health departments and doing things that we are all trying together to add extra clinics and also make sure that we're vaccinating patients whenever it's appropriate to do so.
How damaging was some of the misinformation about effective vaccines perhaps causing autism, which was research that has since been debunked? How damaging was that to the overall effort?
I think it still has an impact, and certainly, within the last decade it had a major impact, but I'm certainly glad that we've had good research studies that have, as you said, debunked that theory, that we know that vaccines are safe, they are effective, and also they're important because the germs are still around.
Oh, we only have a few seconds left, but how do you know all this stuff? Is there reporting, or did doctors' offices report to you? How do you guys
Right,
keep
we work
keep a handle
together.
on it?
I mean, we have 60 primary care physicians who we talk with closely about what they're seeing in their practices, and we also make sure we read the research and the literature as well.
All right. Good to see you again, Doctor.
Nice to see you.
And if you'd like more information on vaccinations, the Department of Health Services has a great website with important information posted. It's called Wisconsin Immunization Registry, and you can find a link at TMJ4.com.